Hello everyone, I'm Sakshi Pujari presenting the topic of aminoglycoside. So here we'll discuss about the interactions and precaution, the pharmacokinetics, dosing regime, gentamicin and streptomycin in detail. So let's get started. So firstly, the precautions and interaction. It should not be taken in pregnancy as it can cause fetal ototoxicity. It can cause ototoxicity, hence should not be taken with other ototoxic drugs like furosemide and minocycline. It can cause nephrotoxicity, hence should not be taken with other nephrotoxic drugs like vancomycin and cisplatin. It is contraindicated in those having kidney disease. Do not mix aminoglycoside with any drug in the same syringe or infusion bottle. So now the pharmacokinetic. Aminoglycosides are highly polar basic drugs. They have poor oral bioavailability. They are administered parenterally or applied locally. They are poorly distributed and poorly protein bound. They do not undergo any significant metabolism. Nearly all IV dose is excreted unchanged in the urine. Dose adjustment is needed in renal insufficiency. Dosing regimen. So these are the values for an average adult with normal renal functions. Gentamicin, cisomycin or nitramycin are given at a dose of 3 to 5 mg per kg per day. Streptomycin, kanamycin or amikacin are given at a dose of 7.5 to 15 mg per kg per day. Now the dosing. There are two types of dosing, single dosing or multiple dosing. Since the T-half of aminoglycoside is very small, that is 2 to 4 hours, so we can also give multiple dosing. But we generally prefer single dosing because aminoglycoside exert concentration dependent killing. They have long post-antibiotic effect. The plasma concentration remains sub-threshold for ototoxicity and nephrotoxicity for a longer period each day, allowing the washout of the drug from endolymph. It is more convenient and cheaper. It is less nephrotoxic. But single dosing should be avoided in children and patients with renal insufficiency. Not recommended when gentamicin is combined with beta-lactam. Now, gentamicin. Gentamicin is obtained from Micromonospora purpurae. It is most commonly used aminoglycoside. It is more potent than streptomycin. It is active against aerobic gram-negative. It is ineffective against Mycobacterium tuberculosis and other mycobacteria. It is equally potent as tobramycin, cisomycin and nitramycin. It synergizes with the beta-lactam. It is relatively more nephrotoxic. Now the uses of gentamicin. So the use of gentamicin is restricted to serious gram-negative bacillary infection. It is used in septicemia, sepsis, fever in immunocompromised patient. In these cases, it is used with penicillin. Used in pelvic infections with metronidazole. Used in SABE, that is subacute bacterial endocarditis, with penicillin G or ampicillin or vancomycin. Used in coliform infection with ampicillin or ceftriaxone. Used in pseudomonal infection with ticarcillin. Used in meningitis by gram-negative bacilli. Now these are some adjustment of dose in case of renal insufficiency. In renal insufficiency, we reduce the dose based on the creatinine clearance levels. Now streptomycin. Streptomycin develops ribosomal resistance very fast. They are of limited usefulness as single agent. Used in plague, tularemia and brucellosis in combination with tetracycline. Used in SABE due to streptococcal viridans, and in this case it is used with penicillin. It is the reserved first line drug for tuberculosis, used only in combination. streptomycin use? Used in the treatment of tuberculosis, subacute bacterial endocarditis. In SABE, streptomycin is given in conjunction with ampicillin, penicillin, or vancomycin. Used in plague. In plague, it is used alone or combined with tetracycline. It is used in tularemia. In tularemia, it is the drug of choice. Now, let's see some multiple choice questions on aminoglycosides. So, first question. Which of the following is not an adverse effect of aminoglycosides? Ototoxicity, nephrotoxicity, discoloration of the teeth, or hypersensitivity? So, the correct option is option C, that is discoloration of teeth. Discoloration of teeth is an adverse reaction of tetracyclines, not aminoglycosides. Question number 2. Most commonly used aminoglycoside: gentamicin, streptomycin, amikacin, or neomycin? So the correct option is option A, gentamicin. Now question 3. Gentamicin is obtained from Streptomyces griseus, Micromonospora purpurae, S. fredi, or none. So the correct option is option B, Micromonospora purpurae. Question 4. Which aminoglycoside is used in TB? Gentamicin, famicidine, streptomycin, or all of the above? So the correct option is option C, streptomycin. Now the fifth question. Ototoxicity is more likely if aminoglycosides are used with loop diuretics, metformin, vancomycin, or cephalosporin. So the correct option is option C, vancomycin. So with this we came to an end. Thank you.